Good evening. Welcome to Monday Reading Live. My name is Vandana PS, one of the reading trainers from Nidus Academy. So, how was your weekend? And I'll wait a few seconds here so that I can make sure that how many of you have joined this live segment. All right. And let me ask you a question before starting this segment. Do you guys doing additional materials every day? Because we have exam this weekend, okay, 26th of October. So, additional materials ഒക്കെ ചെയ്യുന്നുണ്ടോ? Practice ചെയ്യുന്നുണ്ടോ? Okay, so anyway, in this video, I'll be dealing with part A in detail. Okay, in this video, I'll be dealing with part A in detail. And yes, good evening. Hi Monida, good evening. So any students attending this live session for the first time? ആദ്യമായിട്ട് ലൈവ് സെഗ്മെൻറ്റ് അറ്റൻഡ് ചെയ്യുന്ന ആരെങ്കിലും ഉണ്ടെങ്കിൽ ഒന്ന് കമൻറ്റ് ചെയ്തേ. Any students attending this live segment for the first time? No. Okay. So we have a self-prepared material for part A here. That is trigeminal neuralgia. Okay, but I'm not going to the material directly. Okay, I'll show you the material on the screen so that you can just check out the material. All right. So yes, so before reading the material, I would like to introduce you guys regarding part A in detail today. And definitely, സ്ഥിരമായിട്ട് ലൈവ് കാണുന്ന എല്ലാവർക്കും അല്ലേ പാർട്ടിനെ പറ്റി അറിയാം. But I'm just going to explain a little bit more about part A today for all the people who are going to attend this exam in this weekend or in this Saturday. Okay. So what do you guys know about part A? നിങ്ങൾക്ക് part A നെ പറ്റി എന്തറിയാം? What do you know about part A? Yes, what do you know about part A? So why we are doing this part A module in the reading module? Okay, why we are doing part A in this reading module? Okay, so we have actually reading is a module in OET exam, right? So what is reading? This module signifies എന്താണ് ഇതിൻ്റെ importance? What is the importance of reading as a module in this exam? Because if you know the language, okay, see, for example, if in your mother tongue you can read a lot of things very fastly because you know the language. When it comes to a foreign language, it will not be that much easy to read, fast read a particular paragraph or a book or whatever it is. It's not that much easy for us, right? Yes. So what is reading, or what is the significance, or what is the importance of reading as a module in this part? Okay. So we have two different types of reading. നമുക്ക് ഒരു രണ്ട് different types of reading ആണ് actually ഉള്ളത്. And that is passive reading and one is active reading. So what is passive reading, which means when you travel or when you read a book, when you read newspaper, so you can read whatever you want if you know the language. For example, as I already mentioned, your mother tongue. Okay, whereas active reading, which means we are just reading a particular text or a particular paragraph to understand something. നമ്മൾ എന്തെങ്കിലും മനസ്സിലാക്കാൻ വേണ്ടി വായിക്കുമ്പോൾ that's called active reading. So there is a cognitive process inside us. So ഒരു thought process ഉണ്ടാവും. Okay, and that's called in the active reading. So here, reading as a module, it signifies active reading. All right. Then, so what is part A in this module? എന്താണ് part A? What is part A? Hi Sanila, good evening. So what is part A in reading module? Okay, so I'll explain what is part A. So part A is actually gonna create or signifies whether the students are able to do a particular thing within this stipulated period of time. നിങ്ങളൊരു തരുന്ന സമയത്തിനുള്ളിൽ കാര്യങ്ങൾ ചെയ്യാൻ ഏബിൾ ആണോ എന്നാണ് പാർട്ട് എയിൽ ചെക്ക് ചെയ്യുന്നത്. ഫോർ എക്സാമ്പിൾ, if you're going to do a particular procedure in a hospital, നമ്മളൊരു ഹോസ്പിറ്റൽ procedure ചെയ്യാൻ പോവാണ്, and you have no idea how to do this procedure to the patient. See, the patient will not wait for us, nobody will wait for us, അല്ല ആരും നമുക്ക് വേണ്ടി വെയിറ്റ് ചെയ്യുന്നില്ല. So in that particular occasion, if you don't know the procedure, what we can do is maybe we can Google it, or you can read the procedure from the soft copy or from the hard copy. ശരിയല്ലേ? So when you do the same thing, okay, it needs a kind of fast reading technique. അവിടെ ഇരുന്ന് നമുക്ക് പതുക്കെ സ്ലോ റീഡിങ് it's not possible there. Okay, so what we are doing there, it's called active reading or fast reading, quick reading. So likewise, in part A, it is here we are going to deal with quick reading or speed reading. That is the technique. Okay, now this technique we complete we have to complete 20 questions within 15 minutes. Reading is almost 1 hour exam, not almost exactly 1 hour exam. And in this 1 hour, this 1 hour can be differentiated, or you can divide it into 3 different parts: part A, part B and part C. So part A is actually for 15 minutes, 1-5. So the remaining time, which is 45 minutes, you will get for the completion of parts B and C. Part B and C, there is no separate time for that. Together you will get 45 minutes. Okay, so part A, only the time is 15 minutes plus you have to do 20 questions. 20 questions. Is it possible? Is it possible to complete 20 questions within 15 minutes? Yeah, of course it is possible. Actually, if you are a good reader, you can complete 20 questions within 8 minutes. Okay, so let's check how it is possible to complete 20 questions within 8 minutes. 8 minutes 20 questions complete. Okay, so we have a particular strategy for that. So what is the strategy? So every part need a strategy or a method. That is the problem. Okay, maybe students on 340. They are writing for maybe second time, third time, fourth time, fifth time. Okay, but they are still in 340 or 330. Okay, so why? The method we are following, which is wrong. Problem, it's not our fault. It is the fault of the method we are following. Method and the So what method we are applying in part A? The strategy we are applying in part A, which is called skimming and scanning. Okay, so when you hear this particular term, skimming and scanning, it is very easy. No. No idea. You have no idea what is skimming and scanning. So what is skimming and scanning? So skimming, which means fast reading, and scanning, which means we are searching for some important words from the text, okay, from each of the text, and we are going to underline the important words. We are going to underline certain keywords from the text. Okay, so that's called skimming and scanning. So skimming, it's called fast reading or speed reading. It's not a very easy task. Okay, if you're not a reader, it will be very difficult for you to fast read something. So please do practice reading every day. Okay, that is the only simply method you can do. Okay, but reading the habit, we are just attending this exam only to pass this. Dream country attend module, which is reading. Okay, so please do start reading habit. Definitely it will help you to improve the marks. Alright. So yes, so coming to skimming and scanning. So what is skimming? As I mentioned, it is called speed reading or fast reading. Whereas scanning, which means underlining important words from the text. Okay, so important words in the sense we can say keywords from the text. So what are the keywords? If a fresher doubt on keywords I should underline. So there is a doubt. So which are the keywords that I should underline when I read a text? So I'll give you another strategy for that. Okay, so we have a 13 keyword strategy for underlining keywords from the text. Okay, yes, hi Monita, yes. Skimming and scanning method. Very good, Monita. Yes, Alina, good evening. Hi Nimi, good evening. Yes. So what are the keywords that we should underline? The first one is we can underline all the headings. All headings underline. So definitely when you get a text, part A, we have 4 different texts in part A. As you know, text A, B, C and D. And definitely you should underline all the headings from the text. Don't skip any line. Okay. That is, the words underline you should read each and every line completely, fast read it. Plus, you have to underline certain keywords from the text. That is what I said. I hope it is clear. So, what are the things you should underline? The first one is underline all the headings. All headings underline. Second one, underline all the subheadings. Okay, subheadings underlines, and it is definitely they will ask you questions from heading as well as a subheading. Third one, all the numbers, and sometimes numbers will be in the form of words also. For example, THREE 3. It's actually a word, but it indicates a number. So likewise, you should underline all the numbers. That is the third one. Fourth one, all the names. All the names. Sorry, fourth one is not the name. Fifth one is actually names. Fourth one is actually, you can underline all the signs and symbols. Okay, for example, what can I say? Yeah, greater than. Okay, greater than is a sign. Less than is a sign. Equal to is a sign. Percentage is a symbol. So likewise, you should underline all the signs and symbols from each of the text. Clear? Okay, and fifth one, all the names. I can say nouns or pronouns. Okay, so what do you mean nouns? Maybe name of a person or alda perarikkum. Okay, maybe name of a disease condition or a disease condition the perarikkum. Maybe name of a country or a country the perarikkum. Maybe name of a procedure. So whatever names they have mentioned in the para, please do underline all the names. Okay, because why? Because in this question answer sessions, maybe they will ask you questions from who will, who can. Okay, the question which is starting with who, we need a particular person there. Yeah. So please do underline all the names. And sixth one, all the abbreviations. Abbreviation which means all the short forms. So what do you mean short forms which means? Short forms, for example, human immunodeficiency virus, that means HIV. Necrotizing enterocolitis, NEC. So likewise, if they have mentioned in the text, please do underline all the abbreviations, short forms. Seventh one, all the brackets. Okay, so anywhere, maybe in text A or B, C or D, wherever they have mentioned the brackets, please do underline all the brackets. Definitely you can expect a question from the brackets. Okay, and eighth one, italicized or bold words. And what is italics? Okay, because technically we don't have that idea regarding what is italics. Bold, maybe you know that. What is bold words? Bold words. These are bold words. What is italics? It looks like in a slanting lines. Okay, it looks like the letters will be like slanting lines. So that is called italics. Okay, so please do underline the italicized or bold words. That is eighth one. And ninth one, please do underline the words which indicate time. Samayam kanikkunna words nammal underline cheyyunnu. And why we are underlining the words which indicate time? Endukonda nammal underline cheyyunne? Because in short answer questions, okay? They will ask you questions which start with when. W-H-E-N, when. Okay, they will ask you questions which start with when. Eppo, when it was introduced. Okay, when there is a connection. So likewise, the questions will be starting with when. So there needs a preposition that indicates time. Time kanikkunna oru word avada nirbandhamanu. It is compulsory. You should write a word that indicate time. And the next one, 10th one is the words which indicate what? Experiment. Experiment related words. Okay, the word experiment, clinical observation, okay, absorption, procedure, diagnosis. Okay, so likewise we can underline all the words which can be related with experiment. Then the words which indicate research. Research related words on research, researcher, study, aspect, okay, population, criteria, strategy. So likewise, a lot of words which indicate research. And the second last one is, please, I'm not asking you or I'm not saying to underline it, but please do carefully read the first and last line of each and every paragraph as well as all the bullet points. Okay, so that is the last one. 13th one, mark all the bullet points. See, bullet points. Okay, so that is the strategy for underlining the keywords. Okay, I'm not saying, okay, please do always, you should follow this. This will help you to get 20 out of 20 in part if you are following this strategy. Okay, I hope it is clear. Anyway, so coming to this material, so today I'll show you what is skimming and scanning. Okay, then how we can do the question answers, because I've put a very simple material today and also for the freshers. Okay, so yes, and the questions already I've told you, we have 20 questions in total, and this 20 questions I've categorized into 3 different sessions, as you can see here, 1 to 7, which is match the following. Match the following questions. It's not like this match the following. Idalla, they have meant match the following, which means in the you can find out this answer from a text. Don't write the answer there, please do write the text. For example, which procedure might be executed to manage trigeminal neuralgia? Maybe answer is from B. For example, if it is from B, you can mark it there, B. Second question, if it is from C, you can mark it C. Then C. Again, if it is from C, you can mark C. So likewise, please do mark the text. ഏത് ടെക്സ്റ്റ് ആണെന്നുള്ളത് മാത്രം underline ചെയ്യാം. Okay, clear? Then, so what is that? Is match the following set of questions. And 8 to 14, it's called short answer question. As the name itself indicating, the answer should be short. It's not according to us. നമ്മുടെ ഇഷ്ടത്തിന് okay, this is my answer. Lengthy answer ഒന്നും അവിടെ പറ്റില്ല. Okay, so we should cut short the answer. Precise answer should be there. The correct answer should be there. It should be short. Okay, very clearly mentioned here. You can write in a word or a short phrase. Kando. So word itself is a word. Word ennu parayunna oru word alle. And what a short phrase, which means again short phrase is a short phrase. Okay, so maximum 2 to 3 words. Maximum 3, not more than 3. And if you are writing more than 3 words, definitely they will strike it off. No doubt. Okay, so please do write answers in 2 to 3 words. And here in short answer questions, you can see a set of questions, okay, starting with why, when, where, how many, how much. Okay, so these type of question patterns will be there. And if the question is starting with when, there needs a word that indicates time. That is why we have already marked the words which indicate time. And if the question is starting with WHO, who, that is why we are marked in the number mark names. If the question is starting with where, again we are marking these type of prepositions there. So that is another strategy. That is a technique. Okay. Then if the question is starting with how many, how much, there needs a number. Already numbers are marked a student anangil, definitely they will get the answer. So yes. And the pattern or the sentence structure will be different. For example, as you can see here in question number 10, this is starting with a question, what might develop? Okay, and see the next one, 11th one, question is starting from the middle of the sentence, the combined usage of which medication? Kanda, that is another sentence structure. The question is from the initial, okay, beginning in the question todangunnathu, and here the question is here, which medication, from the middle of the sentence. And sometimes question will be at the end of the sentence. Chala samayathu endu varam, avasanam question word chodikam. Okay, so that is a sentence pattern or sentence structure, I can say. Yeah, that's all about that. And the last one is 15 to 20, and these can be called what? Fill in the blanks. It's fill in the blanks. So what do you mean fill in the blanks? We are just filling the blanks as the name itself indicates. Okay, blanks we are just finding out which word is missing or which words are missing. Very simple. Okay, again same instruction is mentioned. You can write in a word or a short phrase. And here in fill in the blanks, always be careful about the grammatical mistakes. Grammar mistakes are very. So please do read the question carefully, okay, and don't do grammatical mistakes here. That's all about part A. I hope it is clear. So we are going to read the text and underline the keywords. And in this particular material, we have a lot of, scientific words, or I can say medications mentioned, name of medication is mentioned. So yeah, let's see. So yes, what is skimming and scanning? Let's see what is skimming and scanning. And when I do skimming and scanning here, it is not easy for you to understand properly, because as you know, fast reading, which means majority of the sentence or majority of the words will be in my mind. And the mind il irikkum. Only rest of the words I can articulate through the mouth. ശരിയല്ലേ? പകുതിയും ഞാൻ സ്പീഡിൽ വായിക്കുമ്പോൾ എനിക്ക് മൊത്തത്തിൽ ചിലപ്പോൾ വായിക്കാൻ പറ്റില്ല, ബിക്കോസ് ദ സ്പീഡ് majority of the sentence or words will be in my mind. എനിക്ക് മൈൻഡിലായിരിക്കും. ഫോർ എക്സാമ്പിൾ trigeminal neuralgia is a condition causing. So likewise, I can only articulate certain type of words or certain words there. ആ ഒരു സ്റ്റേജിലേക്ക് നമ്മൾ വരണം. And it's not easy. And if you have a reading practice or a reading habit, definitely you can. Okay. So I'll show you what is it and let's underline the keywords. But I'm not reading very fastly because you will not understand what I'm reading. So I'll just go with an average, speed. So trigeminal neuralgia is a condition that causes intense pain similar to an electric shock on one side of the face. It affects the trigeminal nerve, which carries signals from the face to the brain. Even light touch from brushing your teeth or putting makeup may trigger a jolt of pain. Then trigeminal neuralgia can be long lasting. It is known as a chronic pain condition. People with trigeminal neuralgia or TN may at first experience short, mild episodes of pain, but the condition can get worse, causing longer periods of pain that happen more often. Often is a word that indicates time. Kanda. It's more common in women and people older than 50. So it is more common. Men and women, not men and women and older than 50. But TN, also known as tic douloureux, doesn't mean living a life of pain. It can usually be managed with treatment. So these are my keywords from the first para. So what are the keywords? Name of the condition I've underlined. Then number I've underlined. The words which indicate time, part of the body, name of the part of the body. Then brushing a habit. So likewise, I can underline the words. From the next one. TN symptoms may include one or more of these patterns. Then we have a lot of bullet points mentioned here. You should read it very carefully and underline all the bullet points. So what are the bullet points? Episodes of intense shooting or jabbing pain that may feel like an electric shock. Sudden episodes of pain or pain triggered by touching the face, chewing, speaking or brushing your teeth. Episodes of pain lasting from a few seconds to several minutes. Pain that occurs with facial spasms. Then episodes of pain lasting days, weeks, months or longer. Some people have periods when they have experienced no pain. No pain situation wonder. Maybe they will ask you a question. Pain in areas supplied by the trigeminal nerve. These areas include cheek, jaw, teeth, gums, lips, or less often the eye and forehead may be affected. Pain on the one side of the face at a time. Pain focused in one spot or the pain may be spread in a wider pattern. Pain that rarely occurs while sleeping. Episodes of pain that become more frequent and intense over time. Okay, so that's all about the keywords from text A. So likewise, you should underline the keywords from each of the text. ഓരോ ടെക്സ്റ്റിനും ഇതുപോലെ നമ്മൾ കീവേഡ്സ് അണ്ടർലൈൻ ചെയ്യണം. Clear? Then text B. So what are the keywords from text B? So here we have a particular flow chart mentioned. One of the text will be a pictorial of something, definitely. എല്ലാ ടെക്സ്റ്റും പാരഗ്രാഫ്സ് ആയിരിക്കില്ല. One of the text, maybe text A, B, C or D will be a pictorial. Maybe ഒരു flow chart ആയിരിക്കും like this. Or a table will be there, or a diagram will be there, or a graph will be there. So likewise, yeah, one of the text will be for sure ഒരു എന്തായിരിക്കും pictorial. Okay, so leading complaint. History. Interview plus examination, investigation. Unilateral orofacial pain. If it is yes, pain distribution within the facial or intraoral trigeminal territory and paroxysmal character of the pain. If it is yes, possible TN, possible neuropathic pain, then pain triggered by typical maneuvers. Clinically established TN is there, probable neuropathic pain. Again, repetition of words are there. Unlikely to be TN, idiopathic TN. Etiology established TN, definite neuropathic pain, MRI. See, abbreviation. Magnetic resonance. So yes, MRI. And so these are my keywords from classical TN as well as secondary TN. These are my keywords. And what about text C? Oh my god, a lot of medications mentioned here. I'm not going to read this type of medications because it is very difficult to read the names, right? Okay, but I'll try. To treat TN, healthcare professionals, see? Who? Healthcare professionals. Prescribe. So who will prescribe the medications? So you can write healthcare professionals. So doctors. Medicines to lessen or block pain signals into your brain. Anti-seizure medicines, health professionals often prescribe carbamazepine. Then a lot of medicines. Okay. It has been shown to be effective in treating the condition. So a lot of medicines mentioned there in the brackets. Other anti-seizure medicines that may used to include oxcarbamazepine. Okay. Then Trileptal, Oxytellar, XR, Lamotrigine, Lamictal and phenytonin. Dilantin, Phenitec, Cerebix. Okay, other medicines that may be used include topiramate, a lot of other medicines. Okay, a lot of medicines. So definitely if any question is asking about a particular name of a medicine, answer evade ariyum. Definitely text D. Sorry, C. Muscle relaxants. So what are the muscle relaxants? Along with baclofen. Okay, so you can provide a combination of baclofen and the carbamazepine. Botox injections will be there. Small studies, study. What indicates? Research. Then onabotulinum toxin A. Yeah, very lengthy name. Botox injections may reduce pain from TN in people who are no longer helped by medicines. However, more research needs to be done before this treatment widely used for this condition. Kanda. With it, 3 words, research related words are there, time related words are there. Other procedures may be used to treat TN such as rhizotomy. Okay, so in rhizotomy, a surgeon restores nerve fibers to reduce pain. This causes some facial numbness. Types of rhizotomy include glycerol injection as well as balloon compression. Okay, a needle that goes through the face and into an opening in the base of the skull delivers medicine to reduce pain. The needle is guided to a small sac of spinal fluid that surrounds the area where the TN nerves divides into 3 branches. Then a small amount of sterile glycerol is injected, and this glycerol damages the trigeminal nerve and blocks pain signals. Then balloon compression, what is it? This procedure involves inserting a hollow needle through the face. Okay, it is guided to the part of the trigeminal nerve that goes through the base of the skull, then thin flexible tube called a catheter. Okay, see, name of the procedure as well as name of the instruments mentioned here, devices. Balloon on the end is threaded through the needle. The balloon inflates through enough pressure to damage the trigeminal nerve and blocks pain signal. So last one is text D. Complications, and instead of complications, maybe they can ask what are the ramifications, what are the risk factors, what are the negative impacts, what is the impact, what is the outcome, what is the result, risk factors. See, a lot of chances. Okay, so what are the complications include? Side effects of the medication. So medications mentioned in text C, side effects of the medicines mentioned in text D. Remember, anticonvulsant medications used to TN cause side effects like sedation, ataxia, dizziness, and drowsiness. These side effects can be more pronounced as higher doses, and some patients may be higher doses to manage the pain. So what are the other problems? Psychological problems will be there, weight loss will be there, okay, depression, anxiety, social withdrawal. Patients may avoid eating to avoid triggering pain, which can lead to weight loss and malnutrition. Poor oral hygiene. So why? Avoid brushing their teeth to avoid triggering pain, which can lead to poor oral hygiene. Facial numbness, corneal anesthesia, jaw weakness, anesthesia dolorosa. Okay, so these are my keywords from text D. Corneal, yes. Clear? So this is how we are going to read and underline each and every important words from these texts. I hope it is clear. Okay, so now we are moving to the question answer session. Okay, so now you guys have an idea. If you're attending this live session, definitely you have an idea what is in text A, B, C, and D. So what is in text A? Just imagine what is in text A. Let me, or please give me a summarized or gist in the comment box. On the comment A, what is in text A, text B, text C, and text D? In a word you can write or in a sentence. On the comment A, hi Dhanalakshmi, Sansi, Jo, Soji, good evening. So what is an overall idea or a summary of text A? I'm not asking you to type a long history. Please do type what do you understand, what is mentioned there in text A. If you know, okay, if it is all about what is the condition, yeah, it is all about the summary of what is the definition of the condition. If it's all about the prevalence of the condition. So likewise, in a word or in a sentence, you can comment what do you understand from text A, B, C, and D. Clear? On the comment amo. What do you understand? What is in text A? Already we have read this text. Okay, we just applied the skimming and scanning method. So what do you guys understood about text A? Again, the month slide. What is in text A? Text A il what is mentioned in text A? Yes, text A, yes, Dhanalakshmi, definition, signs and symptoms. Yeah, very good, dear. So likewise, you should need a particular, paraphrased idea in your mind. Just to summarize it, okay, text is all about the definition, plus signs and symptoms, maybe the prevalence. Okay, and what about text B? There is a pictorial. I've seen a pictorial there, it's a flow chart. And the flow chart is all about, what are the leading complaints? Okay, what are the procedures you can go for after this complaint maybe? Yeah. Okay, so yes, Adhan, about TN, yes, it is a definition about TN, yes, definition, signs and symptoms, yes, Amy, very good. And what is in part text B? Text B il endana koduthikkune. What are mentioned in text B? Leading complaints mentioned, history, examination, simply I can say the study. Okay, simply you can say study mentioned there. Or study ana. Okay. Yes, Dhanalakshmi, text B, leading complaint, history, examination, investigation. Yes, Nimmi, definition, signs and symptoms. And what about in text C? What is in text C? What is in text C? Only the medications. Medications maatrano koduthikkune. What is mentioned in text C? What is in text C? Text C is all about medications, or you can say procedures, treatment. Okay, so text C is all about treatment for TN. Okay, what are the procedures, treatment, medications? So that is in text C. And what about text D? Yes, Dhanalakshmi, text C, medications and procedures. Very good, dear. Yes. Okay, and what about text D? Complications. Yeah. Yes, medication and procedure. Yes, Amy, Nimmi. Okay, Adhan, text C, medications and treatment. Very good, Adhan. Yes. And what about text D, the last one? What are the risk factors or side effects of the medicine? Alright, yes. Complications. Very good, Nimmi. Yes. Okay, yes, Dhanalakshmi, it's all about the complications mentioned in text D. Okay, yes, Amy. Side effects, yeah. Okay, so now we are moving to the first question. So when you read a question from part A, don't forget to underline the keywords. Otherwise, it will be very confusing for you. So please do mark the keywords from the question. And you can think about the keywords. Okay, where is it mentioned? And then find out the answer. Okay, for example, first one. Which procedure might be executed to manage TN? So my keywords. Can you please guess what is the keywords which I am going to mark? I will keywords mark. What are the keywords here? Important words. And when you underline important words, it shouldn't be more than 3. Okay, and I've seen a lot of students, okay, they are marking which procedure might. So likewise, don't underline a group of words. You can words underline. You can underline word by word. Maximum 3, not more than 3. Okay, so procedure is one keyword. Okay, very good, Dhanalakshmi. Procedure, executed, manage. Very good, dear. So procedure, executed, manage. See? Okay, so likewise, you can underline 3 different words. Okay, it's not necessary you should underline 3. I'm just saying not more than 3. Alright. Yeah, so, where is it mentioned? Which procedure might be executed to manage TN? Where is it mentioned? We don't need the answer. Actually, a short answer, we don't need a short answer there. Just say, where is it mentioned? Which text? Yes, Nimmi, procedure and manage. Very good, dear. Okay, so where is it mentioned? What about others? Yeah, Dhanalakshmi, Sansi, Alina. Yes, any other answers? Yes, Vineet. Hi, Vineet. C, okay. Okay, me, procedure, executed, manage. Okay. Asna, Nimmi, Amy, Adhan. Very good. Answer is mentioned in text C. Okay, so answer is mentioned in text C. So where is it mentioned in text C? The procedure. Already when I just gave you a particular gist of the paragraph, this is all about medications and procedures. So other procedures may be used. So procedures kind of management is mentioned in text C. See? So within seconds you can find out the answer. And what about second one? What was the leading complaint in the study that needs further examinations? So what are the keywords here? leading, complaint, study, and all. So remember, so I've told you this is all about a study. So where is the study mentioned here? The complaints mentioned here. Is the text? Yes, Monita, it is text C. Very good, dear. Yes, Asna. Very good, Asna. Your answer is correct, which is from text B. I think only Asna got the correct answer, right? Okay, Adin. Very good, Adin. Okay, so text B. It's from B. Yes, Dhanalakshmi. Very good, B. Okay, Alina. Very good. It's B. Yes, Dilu. It's B. Very good. Okay, so answer is mentioned in B. Text B. And where is it mentioned in text B? The leading complaint. See, already we underlined. We have already underlined the keywords leading complaint of the study. So that is in text B. Clear? Then third one. When can someone have painless episodes associated with TN? So my keywords: someone, painless, episodes. Painless, pain-free, no pain. I don't know whether you guys remember, and something negative is mentioned without pain, no pain. Where is that? Yes, Vineet, it is in text B. Second question. Yes, Amy, very good. So what about third question? So 1, 2 and 3. Yeah. What about third one? Very good. Yes, Dhanalakshmi, your answer is correct. It's from text A. Yes. Okay, Alina, Sansi, Dilu, very good, Dilu. It's from text A. So where is it mentioned? See, episodes of pain lasting days, weeks, months, or longer. Some people periods when they experience no pain. Okay, so no pain. So answer is mentioned in text A. Fourth one, the correlation between the dosage of medicine and its side effects. Okay, so correlation, then medicine, side effects. Yes, these are my keywords: correlation, medicine, side effects. Okay, Nimmi, Amy, Dilu, Sansi, Alina, Dhanalakshmi. All right. Yeah, very good. Text A. What about fourth one? A connection mentioned regarding the dosage of the medicine as well as the side effects of the medicine. So I know side effects are only mentioned in which text? A very direct answer. It's mentioned in text D. No? Yes. Okay. So side effects mentioned in text D. See. Okay. See, these side effects can be more pronounced at higher doses. See the correlation. So answer is mentioned in D. Very good, Dilu. You got the correct answer. Very good, dear. And fifth one. How can we differentiate classical TN and secondary TN? So keywords: differentiate, classical, secondary. Remember classical and secondary? Where was that? It was mentioned in here. See, classical, secondary. So this is the importance of underlining keywords. If you're a student who, there is no idea, I've done underlining the keywords, definitely you will not get the correct answer. Answer. Okay, so that is the importance of underlining keywords. So answer is mentioned in fifth one. It's mentioned in text B. Very good, Amy. Yes, Amy, Dilu, Dhanalakshmi, Alina, Nimmi. It's in B. Sixth one. Who is more liable? Liable here, which means more vulnerable. They can easily affect this disease condition. What? TN. This is more common among them. Arlana. Even though it looked like a short answer question, yeah. Where is it mentioned? Who is more liable to TN? They can affect it very easily. Arka affect better. Yeah, it's mentioned in text A. The prevalence, yeah. Where is the prevalence mentioned here? See, somewhere here I found. Yeah, it's more common in women and people older than 50. Okay, so answer is in text A. And yes, Amy, Alina, yes, Dilu, Dhanalakshmi, Vineet, yes, Vineet. It is in text A. And what about question number 7? How does TN mentally affect an individual? The mental connection, the complication. Where is the mental complication mentioned? Mentally affecting? Mentally affect individual. See, suppose you have no idea where this mental affection mentioned. You can just check your keywords from the beginning. Okay, so just look. Any mental things mentioned here? Mentally affected? No. text D. Any mental affections mentioned? Okay, the problems. This is all about the medicine. So I think, yes, answer is in text D. Psychological problems mentioned here. Kanda. So answer is in text D. Okay, yes, Vineet, Alina, Dilu. Yeah, only 3 got the correct answer, right? Answer is in text D. So what are the answers? C, B, A, D, B, A, D. Okay, so anyone with 7 out of 7? Anyone with 7 out of 7? No. Okay, so I'm just jumping to second set of questions, which is short answer questions. So first one, curtailing which activity in fear of triggering pain can lead to poor oral hygiene. So my keywords, curtailing, activity and oral hygiene. Oh, yes, Dhanalakshmi, Dilu, Nimmi, Vineet. Okay, Sanila, very good, 7 out of 7. And Sansi, Monida, it's pretty good. Okay, and you guys have just started, we have time. Okay, so please do follow all the instructions which I'm saying. Definitely you can score 7 out of 7 next time. Okay. Yeah, so what about 8th one? Curtailing which activity? So what is the meaning of the word curtailing? Curtail down or curtail. Curtail down, which means something else. Yeah, so what is curtailing? Curtail down, which means increase. Increase here. So curtail, which means? Answer is correct. Yes, Alina, Amy. Yes, Nimmi, answer is correct. Which activity? Either you can write there brushing teeth or you can write brushing. Both are correct. I think brushing teeth is a little bit more precise. Perfect brushing teeth. Okay, Santhi, your answer is correct. Brushing their teeth. Actually, there is not coming to, the set of activity. Brushing their teeth is an activity. It's not an activity. Brushing is an activity. Brushing teeth is an activity. But brushing their teeth, it's wrong. Okay, actually answer is it is mentioned there in the para, brushing their teeth, but there is not needed. It's not the activity. So answer is brushing teeth, or you can write brushing. I hope it is clear. Okay. Yeah. So decreasing which activity? You should decrease brushing teeth. So that is mentioned in text D. Poor oral hygiene, patients may avoid brushing their teeth to avoid triggering pain. Kanda. Okay, so answer is brushing teeth. 9th one. How many correct answers? Yes, Dilu, Vineet, Dhanalakshmi. Yes, Nancy, you can cut there. Okay, there cut here. Yes, Nimmi, Amy, Alina. Yeah, it's brushing. Okay. 9th one. Another appellation given to TN. Appellation, which means I think a name, right? Yeah. Designation. So what is another substitution for TN? Yes. What is another word? Or not a word, actually, yeah, a noun. In the para kodka. Okay, chronic pain condition. So what is the name of the condition? Chronic pain condition is not a name. It is a severity. For chronic, mild, acute, it's a severity. So, yeah, the name is something else, I guess. Yes. Very good, Amy. Okay, answer is TIC. Tic Dolorx. It's not Dolorance. It is a, I think it's a French term or an Italian term. I'm not sure, but it is pronounced as Dolora. It's Dolora. Okay, yeah, whatever. So that is Tic Dolora. Okay. Yes, Amy. Asna, you should add tick also there. TIC. Okay. Monida, it is correct. Okay, Dhanalakshmi, your answer is correct. Okay. Alright, it is mentioned in text A. Somewhere here I've seen that name of the condition mentioned. Known as here very clearly mentioned. Tic Dolora. Okay, so answer is there in text A. 10th one. What might develop in patients along with weight loss due to insufficient intake of food? insufficient weight loss, develop. Yes, Nimi, correct answer. What about 10th one, Nimi? What about 10th one? Dhanalakshmi, Asna, Monita, Amy, Vineet, Alina, Dilu. Yeah. It's malnutrition. Okay. Yeah. Very good, Alina. It's malnutrition, and which is mentioned in text D, I think, because I've seen that word there. Yeah. Here. Weight loss. Patients may avoid eating to avoid triggering pain, which can lead to weight loss and malnutrition. So answer is malnutrition. Very good, Alina. All right. Then 11th one, the combined usage of which medication? That is the question. A, the medicine, which medication? Along with baclofen. So it's sure name of the medicine mentioned in text C, a set of medicines. Very good. Yes, Vineet. Carbamazepine. Okay, so please be careful about the spelling. Carbamazepine. Carbamazepine. Okay, so that is the name of the medicine which is mentioned in text C. A very direct answer. Baclofen. Baclofen, the medicine is mentioned here. See? So along with baclofen, what is used? In combination with carbamazepine. Okay. Yes, Alina, Dilu, Monita. It's correct answer. 12th one. Who are assigned to carry signals from the face-to-face brain? Who are assigned signals? Any idea what is the correct answer there? 12th one. Who are assigned to carry? Maybe name of something. Maybe name of a person. Name of a part. Whatever. Yeah, it's a name. I know. It's a name. So what is it? It is T nerve, or yeah, I'm so sorry that abbreviation is not mentioned anywhere. You can write the full form. Trigeminal nerve. Okay, and where is it mentioned? It's mentioned, I guess, in text A. That nerve is responsible for the transmission of, the trigeminal nerve, which carries signals from face to the brain. So answer is trigeminal nerve. Okay, me? Yes, Nancy, yes. Dhanalakshmi, Alina, Vineet, Monita. It's trigeminal nerve. And 13th one, which procedure, the procedure allows a needle to go through the face and into an opening in the base of the skull, delivers medicine to reduce pain? So where they've mentioned about the procedure. So which procedure? Procedure, medicines. Of course, yeah, I'm sure it's in text C. So what is the correct answer? It's not rhizostomy. It is glycerol injection. The procedure. See, other procedures mentioned here related to rhizotomy, but which one? It includes glycerol injection as well as balloon compression. Answer is glycerol injection. Okay, and it is mentioned in text C. And a needle that goes through the face and into an opening in the base of the skull delivers medicine to reduce pain. So what is the procedure called? It is glycerol injection, particularly mentioned. Okay, so answer is glycerol injection. Yes. Okay, Sansi, Dilu, Alina. Yeah, it's glycerol injection. No, it's not balloon compression, Monita. It is glycerol injection. Okay. And 14th one, the procedure that may show neurovascular compression with morphological changes in the trigeminal root to confirm classical TN. So classical TN actually mentioned in text B, right? Okay. And what is the procedure for that mentioned here? Neuropathic pain. Very good, Asna. It's MRI. Okay, MRI is mentioned here. MRI showing neurovascular compression, keywords, morphologic, another keyword. So answer is MRI. Okay, so you can write there MRI. Yes, Sanila, Monita, Alina, Vineet, Dhanalakshmi, Dilu, Nami, Sansi, Amy, Asna, MRI. It is the correct answer. So again, it's completed 14 set of questions. And now it is 15, question number 15. Sedation, ataxia, dissonance. I have seen this somewhere else. Sedation, ataxia, dissonance, drowsiness, or some side effects mentioned in here. Okay, sedation, ataxia, dissonance, and drowsiness. These side effects can be pronounced as higher. So, what is the correct answer there? Anticonvulsant medications, anticonvulsant, not anticonvulsants, it is anticonvulsant, because in the question, let me check the question. Yeah, anticonvulsant medications, already medications mentioned here, so that you can write anticonvulsant. And in the paragraph, the anticonvulsant is hyphenated, right? No, it is not. Okay, so answer is anticonvulsant, yes. 16th one, the balloon inflates with enough dash to damage the trigeminal nerve and block pain signals. So the balloon damage and block. Yes, Alina, your answer is correct, which is anticonvulsant. Very good, dear. Pressure, very good. Answer is mentioned in, again, I think it's not in text D, text C. And I've seen here, somewhere here, regarding pressure. Yeah, see. The balloon inflates with enough pressure to damage trigeminal nerve and block pain signal. So, answer is pressure. Yes, Vineet, Amy. Okay, Vineet, medication is need to be right or not. Where? Question number 15 now. Oh, medication is already mentioned there, so that you can just write anticonvulsant. Okay, there is no need to write medication again because it is already mentioned medications. So that you can write anticonvulsant, only anticonvulsant. Yeah, so that is pressure here. 17th one. Small studies have shown that dash injections may reduce pain from trigeminal neuralgia in people who are no longer helped by medicine. Small studies reduce pain. And what about this one? Small studies have shown that dash injections may reduce pain from trigeminal nerve. So, injections and medicines mentioned in. See, when you see the study, don't go for text B. Text B lano. The name of the injection mentioned. No, I think no. Nothing mentioned in text B. So, text C, the medication. So, what injection is mentioned here? Botox. Either you can write Botox there or you can write this particular lengthy word. And another onobotulinum toxin A. Okay, that is the answer. Either you can write the name of this medicine, this injection, or you can write Botox in the bracket. Both are correct. Either one. Okay, so that's it. And third last. Trigeminal neuralgia or TN is a condition that causes, this is actually a typo. This is a typo. So you can cancel this question. Okay, so it is, I think, a printing mistake. 19th one. If no diagnostic test confirms lesion or disease that can explain TN, then it can be termed as dash. Termed as what? Diagnostic, then lesion, yes. Disease also. Yes, I am marking disease. So, what about 19th one? Explain TN when it can be termed as dash. Idiopathic. Because already TN is here in the question. You don't have to repeat the same. Other random different words on idiopathic. TN is another term. So, you don't have to write that idiopathic TN there. You can write idiopathic. Okay. No need to write TN. Actually, TN is there. Here. Okay, but the one thing you can just write idiopathic there. And where is it mentioned? It is, I think it's mentioned in text B. Yeah. Here, idiopathic TN. See? Already TN is mentioned in the question, so that you can write idiopathic there. Okay, that is enough. And the last one, 20. Patients may avoid dash to avoid triggering pain, which can lead to weight loss and malnutrition. A very simple, very direct answer. Avoid pain, weight loss, malnutrition. Yeah. Already we have seen this, right? It is patients may avoid eating. So, answer is eating. Yes, eating. So yes, correct answer. Yes, we need. Alina, eating is the answer. Alright, so I hope this video was helpful for you because I have explained a lot of things about part A today in a detailed manner. Okay, and if you have any doubts or any concerns, you can comment it here. I'll definitely give a reply. Okay, so that's all about today. So please stay tuned. We will see tomorrow. Thank you. Take care.